When it comes to your baby's sensitive skin, I feel that it's best to trust an expert. And that's why we have Dr. Sanjay Wazir, Medical Director of Neonatology at Motherhood Hospital. He's going to deep dive into essential newborn care with a vast experience in managing newborns. Hello doctor, welcome.
Thank you Ashya, thank you for having me over here, and I'm happy to be here and happy to answer any of your questions that you have for me.
So doctor, a lot of mothers like me, we do endless research before our babies are born. But we still don't have a definite answer on what our newborn skin is going to be like. So could you tell us a little about newborn skin?
Babies are soft, but you also need to understand, like other organs, the heart, the lungs and the kidneys and other organs are developing, so is the skin. And when the baby is born, it is still a delicate skin structure, and it takes approximately 2 or sometimes 3 years for the baby skin to look like an adult skin under a microscope. So when you look at treating the skin, you have to treat it different from an adult skin, and use of harsh products, for example the regular soaps that you use, or maybe the fragrant wipes that sometimes you use, would cause them to have more irritation. On the other hand, when you talk about conditions like your son said, unfortunately had atopic dermatitis, that's a special condition where your skin is already oversensitive or maybe allergic to some of the conditions which we may not know as of now. And those are the things which specially needs to be managed by a pediatrician or a dermatologist.
So doctor, is it normal for a newborn skin to flake? And does it require any special attention?
Yes, it's very normal for children to flake their skin immediately after birth for first couple of weeks when the baby is transitioning from a wet environment inside the womb to a dry environment outside the womb. And the things that one should keep in mind just to make the transition smooth is not to overbathe the child. So generally we see children being bathed on the daily basis, and water tends to remove the natural oils from the skin and cause more damage. So restricting the oil bathing to maybe twice or thrice in a week, and using a moisturizer when the skin is slightly still wet. So you use a towel. In addition, when the skin is slightly still wet, after you have dabbed with a towel, you can apply a moisturizer which is fragrance free and contains natural ingredients, so that will reduce the flakiness of the skin. And sometimes it may be good idea, especially in summer months when you're using an air conditioner, to use a humidifier, because humidifier actually increases the humidity content of the air around the child and keeps the skin supple and moist. If the skin persists to flake after a couple of months, or the skin is swollen and red, in that case it is important that you discuss this with your pediatrician or a dermatologist.
It was such a pleasure to learn so much from you, Dr. Wazir, and as a parent I feel so much more confident after our session.
Thank you Ashya for having me over, and I'm so glad that it has helped you, and I hope it has helped some of your audience as well.
So if you want to learn more about your baby's skin, keep watching Your Baby's Sensitive Skin Expert.